Every single morning, millions of seniors walk into their kitchen and make one mistake that slowly damages their heart and increases their cancer risk, and they have absolutely no idea. I am Dr. Elliot Grant, cardiac surgeon. The food in your refrigerator right now, the one you are planning to reheat for lunch, may be one of the most dangerous things you eat all week. Food number two is in almost every senior's fridge today. Let me ask you something honest. When you open your refrigerator right now, what do you see? Leftovers from last night's dinner, correct? Maybe some rice from 3 nights ago, maybe some pasta from Tuesday, maybe some chicken from who knows when, some spinach that is starting to look a little sad, some mashed potatoes that you made for Sunday dinner and have been reheating every single day since. You think you are being frugal, you think you are being smart, you hate wasting food. I understand completely. You grew up in a generation that taught you to clean your plate and save everything. Waste not, want not. That was good advice when food was scarce and refrigeration was unreliable. But here is the truth that almost no doctor tells you and that no food package warns you about: the way you reheat. Certain foods changes their chemical structure. It creates compounds that inflame your arteries, stiffen your heart muscle, raise your blood pressure, and in some cases increase your risk of stomach cancer, colon cancer, and esophageal cancer. This is not a theory. This is not internet nonsense. This is published science from universities and medical journals. And the problem is that the most dangerous foods for reheating are the ones seniors eat most often: rice, pasta, chicken, spinach, potatoes. These are not junk foods. These are not fast foods. These are everyday staples that most doctors will tell you are healthy, and they are healthy when fresh. But when you cook them, cool them slowly at room temperature, store them in your refrigerator for 3 or 4 or 5 days, and then reheat them once, twice, sometimes 3 times, you are creating a perfect storm for heart damage, inflammation, and cancer-causing compounds. I am not telling you to throw away every leftover. I am not telling you to become afraid of your own kitchen. I am telling you that some foods should never, ever be reheated after a certain amount of time, and today I am going to name 5 of them. Number 2 is in almost every senior's refrigerator at this very moment. You probably have it right now. Let me explain why reheating is the hidden danger in your kitchen, and what you can do tonight to protect your heart. Before I name the 5 foods, you need to understand one simple concept. I promise to keep this simple, no complicated chemistry, no medical school jargon, just the truth about what happens inside that container of leftovers. When you cook food, you kill most of the bacteria. That is good. That is why we cook chicken and meat. But when you let that cooked food sit at room temperature for too long before putting it in the fridge, or when you store it for several days, or when you reheat it unevenly, 2 things happen. First, bacteria that survive the cooking process can grow again. Some of these bacteria produce toxins that heat does not destroy. You can microwave the food until it is steaming hot. You can fry it in a pan. You can bake it in an oven, and those toxins will still be there. They are heat stable. That means you cannot cook them away. They enter your bloodstream through your intestines. They cause inflammation throughout your body, and inflammation is the root cause of heart disease, heart attacks, strokes, high blood pressure, and even dementia. When your arteries are inflamed, they become sticky. Sticky arteries catch cholesterol and calcium and form plaque. Plaque narrows your arteries. Narrow arteries lead to chest pain, heart attacks, and strokes, all from a toxin in 3-day-old rice. Second, certain foods undergo chemical changes when they are cooked, cooled, and reheated. For example, starchy foods like rice, pasta, and potatoes form something called resistant starch. In small amounts, resistant starch can actually be healthy for your gut bacteria. That is why some diet experts recommend eating cooled potatoes. But when these foods sit in your refrigerator for more than 2 days, or when they were left on the counter for hours before refrigeration, bacteria ferment that resistant starch and produce compounds that stress your liver and your heart. Other foods, like chicken and spinach, form nitrosamines and other cancer-linked compounds when reheated multiple times. Nitrosamines are known carcinogens. The World Health Organization has classified them as probably carcinogenic to humans. Your heart has to work harder to filter these toxins out of your blood. Your liver has to process them. Over months and years, that extra work damages your arteries, raises your blood pressure, thickens your blood, and increases your risk of a heart attack or sudden cardiac death. So the problem is not reheating once, immediately the next day from a properly cooled and stored container. The problem is reheating foods that have been stored too long, cooled improperly, left on the counter for hours, or reheated multiple times. Now let me name the 5 worst offenders, starting with number 5. Food number 5 on my list is reheated rice. White rice, brown rice, jasmine rice, basmati rice, arborio rice, wild rice. Any rice. Rice is a staple in so many senior homes. It is cheap, it is filling, it is easy to chew if you have dental problems, it does not spoil quickly, and leftovers are almost guaranteed. You make a big pot of rice on Sunday and you eat it with different dishes all week. Here is the danger. Uncooked rice contains spores of a bacterium called Bacillus cereus. Those spores survive even when you boil the rice at high temperatures. They are like little seeds that wait for the right conditions to grow when you leave cooked rice at room temperature. For more than 1 hour, those spores germinate and multiply rapidly. The bacteria produce two types of toxins. One causes vomiting within 1 to 6 hours, the other causes diarrhea within 6 to 15 hours. But worse than the vomiting and diarrhea, those toxins also trigger a systemic inflammatory response in your entire body. Inflammation damages the inner lining of your arteries, a layer called the endothelium. That lining is supposed to be smooth and slippery so blood flows easily. When it gets damaged, it becomes rough and sticky. Damaged arteries attract white blood cells, cholesterol, and calcium. That combination forms plaque. Plaque builds up over years. Eventually, a piece of plaque can break off and block an artery completely. That is a heart attack or a stroke. Reheating the rice does not kill these toxins. You can microwave it until it is dry and hard. You can fry it in a hot pan with oil and eggs. The toxins remain. They are heat stable. I have seen this in my practice more times than I can count. Patient Martha, 74 years old, ate leftover rice that had been in her refrigerator for 5 days. She reheated it thoroughly. Within 4 hours, she was vomiting so violently that she became severely dehydrated. Her blood pressure dropped dangerously low. Her heart rate shot up to 140 beats per minute. Trying to compensate, she was admitted to the cardiac unit with what looked like a heart attack. Her heart enzymes were elevated, her EKG was abnormal, but after 2 days of 4 fluids and rest, everything returned to normal. It was not a heart attack, it was a severe inflammatory response to rice toxins that mimicked a heart attack. I am not saying you can never eat leftover rice. The safe way is to cool the rice quickly within 1 hour of cooking by spreading it on a shallow tray or baking sheet, then put it in the refrigerator and eat it within 24 hours. Reheat it only once and only until it is steaming hot throughout. Never reheat rice that has been in your fridge for 3 or 4 or 5 days, and never ever eat rice that was left on the counter overnight. That is how you end up in my hospital bed. Do not let that be you. Food number 4 is reheated spinach, along with kale, Swiss chard, beet greens, collard greens, mustard greens, and even cooked lettuce. Leafy greens are incredibly healthy when fresh. They are full of vitamins, antioxidants, and minerals. I tell my patients to eat spinach every single day, but here is the problem that almost no one knows. Spinach and other leafy greens contain high levels of nitrates. Nitrates themselves are not dangerous. In fact, your body converts them into nitric oxide, which actually helps relax your blood vessels and lower your blood pressure. That is good. That is why fresh spinach is heart healthy. However, when you cook spinach and then let it sit at room temperature for too long, or store it in your refrigerator for more than 24 hours, bacteria convert those healthy nitrates into nitrites, and then into nitrosamines. Nitrosamines are known carcinogens. The International Agency for Research on Cancer classifies them as probably carcinogenic to humans. They increase your risk of stomach cancer, esophageal cancer, and colon cancer, but the heart danger is also very real. Nitrosamines cause oxidative stress. Oxidative stress is like rust inside your body. It creates unstable molecules called free radicals that damage your heart muscle cells, your blood vessel walls, and even your DNA. Over time, that damage leads to stiff arteries, high blood pressure, heart failure, and arrhythmias. Let me give you a real example. My patient Eleanor, 69 years old, loved spinach. She would cook a large batch of creamed spinach on Sunday and eat a little bit every day for lunch. By Thursday or Friday, the spinach had been reheated 2 or 3 times. She started complaining of headaches, nausea, and a racing heart after eating. She thought it was her blood pressure medication. When I asked about her diet, she mentioned the spinach. I asked her to stop reheating spinach and eat it fresh instead. Within 2 weeks, her symptoms completely disappeared. The nitrosamines from repeatedly reheated spinach were causing her blood vessels to constrict and her heart to race. The safe way to eat spinach is to cook only what you will eat immediately. If you have leftover cooked spinach, do not reheat it. Eat it cold on a salad. Mix it into cold pasta. Salad, or better yet, throw it away after 24 hours. Never reheat spinach twice. Never reheat spinach that has been in your refrigerator for more than 1 day, and never ever feed reheated spinach to a child, an elderly person, or anyone with a weak immune system. The risk is simply not worth taking. Food number 3 is reheated chicken. Chicken is a senior favorite. It is lean protein. It is affordable. It is easy to prepare in bulk. You can roast a whole chicken on Sunday and eat it for days. Chicken salad, chicken soup, chicken sandwiches, but chicken is also one of the most dangerous foods to reheat incorrectly. Here is why: raw chicken often contains bacteria. Like Salmonella and Campylobacter, these are common. The CDC estimates that 1 in every 25 packages of chicken at the grocery store contains Salmonella. Cooking kills these bacteria. That is why you cook chicken to 165 degrees Fahrenheit, but when you cook chicken and then let it cool slowly on the counter, for 2 or 3 hours before putting it in the fridge, any bacteria that survived the cooking process or any bacteria that landed on the chicken from your hands, your utensils, your cutting board, or even the air can multiply rapidly. When you reheat that chicken 3 days later, you might kill the bacteria themselves, but you do not destroy the toxins they have already produced. Those toxins are heat stable. They cause food poisoning symptoms like nausea, vomiting, abdominal cramps, and diarrhea. For a young person, that is miserable but survivable. For a senior, diarrhea is not just uncomfortable, it causes severe dehydration. Dehydration thickens your blood. Thick blood is like molasses instead of water. Your heart has to pump much harder to move thick blood through your arteries. In a senior with even mild, undiagnosed heart disease, that extra workload can trigger chest pain, shortness of breath, a dangerous arrhythmia, or a full heart attack. I have admitted more seniors to the hospital for dehydration-induced heart problems from food poisoning than from any other single cause. Let me tell you about James. James was 68, a retired construction worker. He ate leftover chicken that had been in his refrigerator for 4 days. He reheated it in the microwave but did not stir it, so some parts were cold. Within 6 hours, he had severe diarrhea. He lost so much fluid that his blood pressure dropped to 70/40. His kidneys started to fail. His heart rate went up to 150 beats per minute. He spent 5 days in the hospital, 2 of them in the cardiac intensive care unit. He survived, but his heart was permanently weaker. His ejection fraction, which is a measure of how well your heart pumps, dropped from 55% to 40%. That is heart failure, all from 4-day-old chicken. The safe way to reheat chicken is to do it only once within 24 hours of cooking, and only until the internal temperature reaches 165 degrees Fahrenheit. Cut the chicken into small bite-sized pieces so it heats evenly. Use a food thermometer. Do not guess. Never reheat chicken in a microwave without stirring or rotating it halfway through, because microwaves heat very unevenly. And never ever reheat chicken that has been in your refrigerator for more than 2 days. Freshly cooked chicken is heart healthy. 3-day-old reheated chicken is a risk you should not take. Food number 2 is the one I warned you about in the opening, the one in almost every senior's refrigerator right now, at this very moment, as you are watching this video: reheated pasta and noodles. This includes spaghetti, macaroni, fettuccine, linguine, penne, rotini, ramen noodles, udon noodles, soba noodles, and even pasta salad that has been sitting in your fridge for days. Pasta is cheap. Pasta is filling. Pasta is easy to chew. Leftovers are so common that most seniors do not think twice about reheating a bowl of spaghetti that has been in the fridge since Tuesday. You add a little sauce, microwave it for 2 minutes, and call it lunch. But here is the danger that nobody tells you. Pasta, like rice, is a starchy food. When you cook pasta and then let it cool slowly on the counter, the starch molecules rearrange themselves into a form called resistant starch. Again, a small amount of resistant starch can be healthy for your gut bacteria. It acts like fiber. That is not the problem. The problem is what happens next. When you store that pasta in your refrigerator for 2, 3, 4 days and then reheat it, the same Bacillus cereus bacteria that affect rice also grow on pasta. Those bacteria produce a liver toxin called cerulide. This toxin causes nausea and vomiting that can last for 24 to 48 hours. The vomiting causes severe dehydration. The dehydration stresses your heart. But there is a second danger that is even worse for seniors, especially seniors with diabetes or prediabetes. Reheated pasta has a very high glycemic index. In fact, reheated pasta can spike your blood sugar even higher than fresh pasta when you reheat pasta. The resistant starch breaks down and becomes rapidly digestible starch. That means it turns into sugar in your bloodstream very quickly. High blood sugar damages your blood vessels directly. It makes your blood stickier. It increases inflammation throughout your body. It damages the nerves that control your heart rate over time. That leads to atherosclerosis, which is the hardening and narrowing of your arteries. Every time you eat reheated pasta that has been sitting in your fridge for 3 or 4 days, you are slowly, silently damaging your arteries. Let me tell you about Frank. Frank was 71, a retired mail carrier. He loved pasta. His wife made a large pot of spaghetti every Sunday, and Frank ate the leftovers every day for lunch until Thursday or Friday. He did not have diabetes, but his blood sugar was borderline. He started having episodes of chest tightness after lunch. He thought it was heartburn. He took antacids. They did not help. When he finally came to see me, I asked him to keep a food diary. Every time he ate 3-day-old reheated pasta, his blood sugar would spike to over 200, and within an hour he would feel chest pressure. I asked him to stop eating leftover pasta older than 24 hours. Within 2 weeks, his chest pain completely stopped. His average blood sugar dropped by 20 points. The safe way to eat leftover pasta is to cook only what you need. Pasta is so cheap and so quick to cook that there is really no reason to make large batches. If you have leftovers, cool them quickly within 1 hour by rinsing with cold water, then store them in the refrigerator and eat them within 24 hours. Reheat once thoroughly and never reheat pasta that has been in your fridge for more than 2 days. Your heart will thank you, and if you have diabetes or prediabetes, please do not reheat pasta at all. Eat it fresh or eat it cold as pasta salad. Your blood sugar and your arteries will be much healthier. Food number 1 is the most dangerous of all. Reheated potatoes, baked potatoes, mashed potatoes, roasted potatoes, fried potatoes, potato salad, scalloped potatoes, any potato that has been cooked, cooled, and reheated. Here is why this is at the top of my list. Potatoes, like rice and pasta, are starchy, but potatoes are unique because they are often cooked in large batches and stored for many days. Think about Thanksgiving. You make a huge pot of mashed potatoes on Thursday. You eat them on Thursday, Friday, Saturday, Sunday, and maybe Monday. You reheat them in the microwave every single day. That is extremely dangerous for 2 reasons. First, the bacteria that grow on cooked potatoes, especially Clostridium botulinum, produce a toxin that causes botulism. Botulism is rare but deadly. It causes muscle paralysis, starting with your eyes and face, then moving to your throat and chest, and finally the muscles you use to breathe. Botulism has a mortality rate of 5 to 10% even with modern medical care. The bacteria grow in oxygen-free environments, like the center of a large pot of mashed potatoes that was left at room temperature too long before refrigerating. Reheating does not kill the botulism toxin. It is heat stable. However, even when botulism does not occur, reheated potatoes cause another very serious problem. When potatoes are cooked and then cooled slowly, the starches convert into resistant starch that ferments in your gut. That fermentation produces gas, bloating, and inflammation. But the real heart danger comes from something called acrylamide. Acrylamide is a chemical that forms when starchy foods are cooked at high temperatures. Especially when they are fried, roasted, baked, or reheated again and again, acrylamide is formed through a chemical reaction between sugars and an amino acid called asparagine. Potatoes are very high in asparagine. The longer you cook or reheat potatoes, the more acrylamide forms. Acrylamide is a known neurotoxin and a probable human carcinogen. The World Health Organization says acrylamide is a public health concern. It damages your nerves and increases your risk of kidney cancer, ovarian cancer, and endometrial cancer, but it also causes oxidative stress in your heart muscle. Studies have shown that high acrylamide intake from foods like reheated potatoes, coffee, and burnt toast is linked to a significantly higher risk of heart disease and stroke. Let me tell you about Robert, not the Robert from my other video, a different Robert. He was 73, a retired farmer. He ate reheated mashed potatoes almost every day. His wife would make a large pot on Sunday and they would eat it all week. Robert came to me with high blood pressure that would not respond to medication. He had fatigue, shortness of breath, and vague chest discomfort. I asked about his diet. When he told me about the potatoes, I asked him to stop reheating them. I asked him to eat fresh potatoes only, cooked in small batches. Within 1 month, his blood pressure dropped by 15 points. His energy improved. His shortness of breath went away. The chronic inflammation from daily acrylamide exposure had been causing his blood vessels to constrict and his heart to work harder. The safe way to eat potatoes is to cook them fresh. A baked potato takes less than an hour in the oven. Mashed potatoes take 20 minutes. There is no reason to make a week's worth at once. If you have leftover cooked potatoes, do not reheat them in a microwave or oven. Eat them cold, like in a potato salad that was kept properly refrigerated and eaten within 24 hours. Never reheat potatoes that have been in your refrigerator for more than 24 hours, and never ever reheat potatoes that were left at room temperature for more than 2 hours after cooking. That is how my patient Walter, a 72-year-old retired teacher, ended up in the cardiac intensive care unit with a heart attack triggered by severe dehydration and inflammation from potato poisoning. He survived, thank God, but his heart never fully recovered. His ejection fraction dropped from 55% to 35%. He now gets short of breath walking to his mailbox, all from reheated potatoes. Please do not make his mistake. So what should you do instead of reheating leftover foods for days and days? I am going to give you 5 simple, safe rules that I give to all my senior patients. Please write these down or take a screenshot. Rule number 1, cook smaller portions. I know you were raised not to waste food. I know it feels wrong to cook only 2 chicken breasts instead of 6. I know your mother taught you to clean your plate and save every scrap. But cooking smaller portions means you have no leftovers to worry about. Your heart is worth more than a few dollars of saved food. Rule number 2, if you do cook extra, cool it quickly. Do not leave cooked food on the counter for more than 1 hour. Spread it out on a shallow tray, a baking sheet, or a large plate so it cools faster. Do not put a large pot of hot food directly into the refrigerator because the center will stay warm for hours, allowing bacteria to grow. Divide large portions into smaller, shallow containers. Then put the food in the refrigerator within 2 hours of cooking total. Rule number 3, eat leftovers within 20. For 48 hours maximum, put a piece of masking tape on the container with the date you cooked the food. Write the date in permanent marker. If it has been more than 2 days, throw it away. Do not smell it. Do not taste it. Do not try to salvage it by cooking it longer. Throw it away. Your garbage can is cheaper than your hospital bed. Rule number 4, reheat only once and reheat thoroughly. Use a food thermometer if you have one. Chicken and meat need to reach 165 degrees Fahrenheit. Rice, pasta, and vegetables need to be steaming hot throughout, with steam rising from every part. Stir microwaved food halfway through to eliminate cold spots. Let it stand for 1 minute after microwaving so the heat distributes evenly. Rule number 5, when in doubt, throw it out. That piece of chicken that has been in your fridge for 5 days. Throw it out. That pasta that smells a little sour. Throw it out. That spinach that looks slimy. Throw it out. That potato salad that has been sitting out at the potluck for 4 hours. Do not eat it. The cost of new food is nothing compared to the cost of a hospital stay, a heart attack, a stroke, or a cancer diagnosis. You are not being wasteful. You are being wise. Your heart has carried you for 60, 70, 80 years. It has never complained. It has never taken a day off. Treat it with the respect it deserves. Feed it fresh food. Avoid these 5 reheated dangers. And if you want to save money, buy smaller portions more often instead of bulk portions that force you to store leftovers for a week. Frozen vegetables are perfectly fine. Canned beans are fine. You do not need to cook everything from scratch in giant batches. If you have made it to the end of this video, you now know something that most seniors will never learn until it is too late. The food in your refrigerator right now could be slowly damaging your heart and increasing your cancer risk, but knowing is not enough. You need to take action tonight before you reheat that container of leftovers for dinner. First, click the like button right now. This is not for me. This is for every senior who will see this video in their recommendations tomorrow. The more likes this video gets, the more YouTube shows it to people who need this warning. Second, subscribe to this channel and turn on the notification bell. I post a new senior health warning every single week. Next week, I am revealing the #1 cooking oil that seniors should never use after 60. It is in almost every pantry. Right now, it is marketed as healthy. It is not. You do not want to miss that video. Third, and most important, share this video with your spouse, your siblings, your parents, and anyone you know over 60. Send it in a text message. Post it on Facebook. Email it to your bridge club, your church group, your senior center. Talk about it at your next family dinner. Print out the list of 5 foods and stick it on your refrigerator door with a magnet. You could be the reason someone checks their leftover rice before reheating it, avoids a trip to the emergency room, prevents a heart attack, or catches a cancer early. You could save a life by sharing this video. I have seen too many patients like Robert, like Martha, like Frank, like Walter. Good people who did not know that their kitchen habits were hurting their hearts. Now you know. What you do with this information is up to you. This is Dr. Elliot Grant, cardiac surgeon with 25 years in the operating room, reminding you that your Heart is not a garbage disposal. Do not feed it yesterday's danger. Feed it today's safety. Stay healthy, eat smart, and I will see you in the next video.